Hello, my name is Jocelyn Villarreal, and today I will be doing a cardiac and peripheral vascular examination as an advanced health assessment student. First and foremost, our patient is a 24-year-old Hispanic male presenting to the clinic for a wellness checkup. He's alert and oriented without any chest pain or shortness of breath. He denies any allergies, and he denies history of cardiovascular disease, tobacco use, alcohol intake, or other illicit drugs. His vital signs were collected and are as follows. Blood pressure 119/81, respiratory rate 14, heart rate 81, temperature 98.5, and oxygen saturation at 100% on room air. So first and foremost, I would like to obtain the consent of a patient to get a recording of today's assessment. Is that okay with you?
Yes.
Thank you. Okay, so having already washed my hands, I'm ready to proceed with the inspection portion of the assessment. And we're starting off by looking for the jugular veins and the carotid pulses bilaterally. So I can see the pulsation for the jugular vein here, and I'm going to take a note. And I'm going to proceed and measure it against the sternal angle. And I can see that it is at 2.5 centimeters above the sternal angle, and 3 centimeters and above could be something that could indicate elevated right heart pressure. I'm also going to be checking for the carotid pulses. And the carotid left and right arteries are without thrill with an expected amplitude of 2+. An increase in fluid in cardiovascular system, such as with heart failure exacerbations, can cause for bounding pulses in the carotid. So next I will be palpating the point of maximal impulse to the left midclavicular line at about the 5th intercostal space. And it is less than 3 centimeters and brisk in tapping, which are expected findings. So displacement of this can suggest a left ventricular mass. So next I'll palpate for the systolic impulse of the right ventricle at the left sternal in between the 3rd and 5th intercostal spaces. Okay. Now I'm going to be moving up to the 2nd intercostal space to check for the pulmonic artery impulse. And now moving to the right 2nd intercostal space to assess for the aortic arch. So upon palpation, all heart regions are without thrills, lifts, or heaves, and with an amplitude of 2+, which is expected. And in this case, we would expect a thrill to be suggestive of valvular disease. If the PMI cannot be palpated, checking the location of the left heart border can provide more information to whether the heart size is normal or increased. And this sound is just medial to the midclavicular line. So now I'll be listening to your heart sounds. Starting off with your aortic valve, the pulmonic valve, tricuspid, mitral. So the heart sounds and rhythm for the patient are normal. S1 and S2 are audible without any extra heart sounds. I'm going to ask for you to slowly roll towards your left side. And I'm going to listen again, but with the other side of my stethoscope. A little bit more, please. And again, S1 and S2 were audible without any extra heart sounds, such as S3 or S4, and these can be suggestive of decreased compliance of the ventricle. So now, sitting up, I'm going to have you lean forward and hold your breath after full exhalation. So no aortic murmur was noted with this examination, and the heart rate and rhythm were normal without any extra heart sounds, such as murmurs, gallops, or rubs. S1 and S2 again were audible with normal intensity and without any splitting. So for example, murmurs can be pathological or benign, and as an example is in aortic stenosis. You would most commonly hear this kind of murmur on the right second to third intercostal space. It would be harsh in sound. It would crescendo and decrescendo, and it would radiate towards the carotids, and it would be in the mid-systolic phase. So now moving on to the peripheral vascular assessment, starting off with inspection. I see that both arms and hands are bilateral and symmetric in size, without any swelling, any prominent veins, none are noted. The skin is tan without any bluish discoloration, and the fingernails have no abnormal visible findings. They're not cyanotic, and there's no clubbing, which could be common in patients with chronic respiratory illnesses. So now inspecting the lower legs, I can see that there is no swelling bilaterally. The legs appear symmetric in size, and the skin is tan without any discolorations. So here, for example, we are looking for any like dusky red skin, which can be a result of peripheral arterial disease. I can see that the hair is evenly distributed on both legs, and there's no abnormal visual findings in the toenails, such as nail thickening. Also, no varicosities are seen in either leg, again, being something that would indicate peripheral arterial disease. And lastly, there's no lesions, no ulcerations, or pigmentation of the lower extremities, all of which can be suggestive of venous insufficiency. Now I'll be moving on to the palpation, starting off with your upper extremities. I'm going to be checking your pulses here, and this is your radial pulse, and your radial pulse, and the same on your left. And both right and left upper arm pulses are expected, so at a 2+ without any thrills. And now to check your epitrochlear nodes here, I'm going to have you bend your arm at a 90-degree angle. And the right node is not palpable. And the left node is not palpable either. So here we will see an inflammation of these nodes with systemic inflammation or pathological diseases. So next I'm going to be checking for the capillary refills in both hands. And all fingernails were less than 3 seconds each, indicating good perfusion to the nail beds. So I'll be checking the pulses of your lower extremities now. For this, I'm going to have you pull up your gown a bit so I can check your pulses in your inguinal area. This being your femoral pulse, your popliteal pulse, your posterior tibial, and your dorsalis pedis. And I'm going to do the same on your other leg. And up to your femoral. So all pulses were at a 2+ expected without any thrill, and these are important to assess to determine if the patient has peripheral vascular disease. Next, the inguinal nodes can be palpated along the inguinal ligament, and they're responsible for draining parts of the trunk, the genital area, the back, and the lower extremities. And again, I'm going to be palpating near your inguinal area. On your other side. And these again are non-palpable. Lastly, I'll be checking for the temperature of the skin in the lower legs, and it is warm to the touch. Here we would see cool skin, which can be signs of PAD. Also, I can note that the legs are non-edematous bilaterally, and to double check that there's no pitting edema, I can press here for about 5 seconds and release, and there is no pitting. Next, I'll be checking the capillary refill of your toenails. And the color returns to pink in under 3 seconds for the left and the right toenails. Lastly, we'll be checking for any arterial insufficiency of the lower legs. So I'm going to have you lift your legs up here to about a 60-degree angle, and I'll put these pillows beneath. And we're going to wait until the legs develop pallor. And now I'll have you go ahead and sit up. And here we are waiting for the color to return to the legs. And we can see that there is a return of color in about 10 to 15 seconds, which would be indicative that there is good circulation in the lower extremities for this patient. And for this last exam is the Allen's test. I'm going to have you open and close your fist as quickly as you can, and then form a tight fist. I'm going to occlude both the ulnar and radial artery. Open your fist. And we can see the color return back to the skin. And let's do that again, but I'm going to unocclude your radial artery. Open your fist. And I can see the color return briskly to the right hand, indicating that this on your left hand is a negative Allen's test, meaning that there is good perfusion or circulation to your hand. And we'll do the same test now on your right. Okay. Open. All right, and let's do that one more time. Open. And we see brisk return of color, again indicating a negative Allen's test on your right hand. And with that, that concludes our examination for today.